everybody. Welcome to the respiratory world. My name is Mr. Acero, and today we're going to be talking about diagnostic chest percussion. Okay, diagnostic chest percussion. Diagnostic chest percussion is a patient assessment tool that we can utilize as respiratory therapists. Okay, we utilize diagnostic chest percussion in order to assess abnormalities in the patient's lung densities. You use your middle finger here, right? And the way it works is you're going to have to press that finger in between the intercostal space, right? So here you might feel your ribs. You can come down and you can feel the intercostal space of your patient. And now what you have to do, you have to be pretty precise and with your speed and your pressure, percuss your patient's chest. Okay? So as we do diagnostic chest percussion, you're going to be having your patient sit up at the edge of the bed, or maybe in a high Fowler's position, or in a chair in the patient's room. They can have their gown on, but preferably skin to skin would be better for diagnostic chest percussion with your patient assessment. Okay, and so you want to assess both anterior and posterior of your patient. You want to percuss both sides, the front and the back. And so here, I'm just going to bring up a couple pictures. And as you percuss, as you do your diagnostic chest percussion, you're going to start right to left, right? So you're going to go 1, 1, 2, 2, 3, 3, and so on and so forth. And then you're also going to do that to the patient's posterior side, their back side, right? Just following this diagram here. And so as we percuss, we will hear different types of vibration, different types of sounds, right? I'm going to refer to these sounds here, these key terms, which are very important, not only for your practice, but also for your board examination, right? And so here we have the term resonant, right? Resonant is normal air-filled lungs, okay? This is going to be normal, all right? Typically giving like a kind of hollow sound. Next we have here, it's going to be flat, right? And flat, when you hear flat or see flat on your board exams, I want you to start thinking possibly atelectasis. The next key term I want to talk to you about is dull, okay? And when you see or hear the word dull, I want you to start thinking possible pleural effusion, okay? Possible pneumonia. In pleural effusion, we have fluid that is built up in the pleural space that tends to muffle that normal hollow sound of an air-filled lung. So that's what dull is. Dull, I want you to think of pleural effusions and possibly pneumonias, okay? Next you'll see the word tympanic, timpani. Now this sound is going to be heard over your stomach area, okay? It's kind of like a drum-like sound.
Tympanic, 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 dull. Let's have you roll this way. Tympanic again, so that's shifting dullness. Great, thank you.
And then so another key term is hyperresonant. Hyperresonance during chest percussion. Now when you hear hyperresonance, it just means more hollow, more air. In patients with pneumothorax, where there's air in the pleural space, as opposed to a normal air-filled lung, you will hear loud, echoing, booming sounds. All right, you would also hear hyperresonance in emphysema. In emphysema, why? Because of all that trapped air in the lungs. They have more air in the lungs, so they're hyperresonant, right? Whereas, again, resonant is going to be normal, all right? Flat, I want you to think of atelectatic lungs, okay? If you hear dull on your percussion, I want you to think of pleural effusions, pneumonias, okay? Tympany, the word tympany, right, is going to just be heard over your stomach area. Whereas hyperresonant is going to be your pneumothoraxes and your emphysematic patients, okay? Well, I hope this helps. Please reach out to us if you have any questions. Have a great day.